As we've mentioned, President Trump says he's feeling really good and he's ready to go. After receiving an experimental antibody cocktail, he returned to the Oval Office Wednesday, less than 1 week after announcing he tested positive for coronavirus. For more on the president's condition, I want to bring in Dr. Angela Rasmussen. She's a virologist at Columbia University. Dr. Rasmussen, thank you so much for being with us. So President Trump is touting this experimental treatment with the drug Regeneron as a cure. Now, we know there's no cure for the virus, but what do we know about this drug, and is it irresponsible for the president to be calling it a cure?
It's absolutely irresponsible for the president to be calling it a cure. We can't tell about a drug's efficacy based on its performance in one patient. President Trump was also given other drugs in addition to that, which also could be responsible for his rapid recovery. What we do know about this drug is that it's a monoclonal antibody cocktail that usually it works by basically binding and neutralizing the virus. So it's effectively an antiviral. The president did get a very large dose of this drug, but without anything to compare it to, without randomized controlled clinical trial data, we can't make any conclusions about its efficacy based on President Trump's being treated with it.
And doctor, yesterday, the president's physician released a new memo saying that he's been symptom-free for 24 hours. He has detectable levels of COVID-19 antibodies. What does this tell us about the president's current condition?
Well, certainly being without symptoms for a period of time probably means that he's recovering and getting better, although it's really too early to say. In terms of his antibody levels, that could mean two different things. It could mean that he's mounting an antibody response, which is what most people do after they're infected with the virus, including SARS coronavirus 2. It could also mean that they're detecting those monoclonal antibodies that he was treated with. So the half-life of those antibodies is about 3 weeks. He got a very large dose of that antibody, 8 grams of that cocktail. So you would definitely be detecting those antibodies in his blood after just several days post-treatment.
And doctor, the Commission on Presidential Debates has made next week's presidential debate a virtual one. The president is saying he's not going to participate, that he may hold a rally instead. But from a medical standpoint, what do you make of the decision to hold a virtual debate? And what do you think of the president's desire to get back to campaigning in person?
Well, I'm disappointed that the president's not going to participate in a virtual debate because for a couple reasons. First off, I think a virtual debate is the only safe way to have a debate right now. I think the debate last night should also have been virtual. Unfortunately, it's not. In a room like that, in an indoor environment, you cannot rely on simply plexiglass and distancing to fully protect the debate participants. The other reason I'm disappointed that President Trump is not willing to participate in a virtual debate is that there is a lot of interruptions during these debates, and a virtual debate would allow the option of the moderator to mute President Trump when he's not supposed to be speaking.
Which may be one of the reasons he doesn't want to participate. But what do you think of his decision to try and hold in-person rallies?
I think that's a very irresponsible decision as well. Anytime you have a large event with a crowd of people who are predominantly unmasked, who will not necessarily be physically distancing from one another, even if it's outdoors, that still presents a significant transmission risk. We already know that there was an outdoor component to the Amy Coney Barrett ceremony at the Rose Garden that resulted in the infection of a number of people. Given that many people on Trump's campaign and Trump himself have tested positive for SARS coronavirus 2 infection, I think it's a potential disaster waiting to happen.
Dr. Angela Rasmussen, thank you so much for joining us. We appreciate your medical expertise.
Thank you.